I came here to do something. And I think at the top of our list is providing for the safety and security of the American people. That's at the top of our list.
His own like pulled himself up from his bootstrap story, and he gets really weepy. So the campaign is called "Will You Cry for Me, John Boehner?" And so I think it would be good if everybody took a tissue box and then we tried to find a central place, like to stack them
in his office.
We started this campaign a couple of months ago called "Will You Cry for Me, John Boehner?" And we launched it because healthcare now, we have membership all over the country, and we hear from people all the time and how much they're suffering and strapped for cash and getting screwed by the system. And the proposals that are coming out from the Republicans and the Democrats too, any proposals to cut or privatize Social Security, Medicare, or Medicaid, or social insurance programs that are, you know, for what they are, they're the social safety net in this country. Any of these proposals to limit these programs are just going to devastate people across the country. So we asked our membership, you know, why don't you tell John Boehner why he should really be crying? We don't have anything against crying. We cry all the time, but for different reasons. And so we have hundreds of testimonials that came in. Over 2,000 people signed the petition. And we're going to John Boehner's office here on Capitol Hill in Washington, D.C. To deliver the testimonials from people all over the country.
Okay. Do you have an appointment?
No.
We're just going to walk in?
Yep. So I think it's one floor down. Sorry.
Any messages that you
Would it be
have?
possible to speak to the legislative team that can help?
I will check if you.
That'd be great.
Okay, could you take a seat?
Thank you. Thank you so much. Yeah, I will take his card. And on behalf of our members, we're here with some really important messages from people around the country. Healthcare Now is an organization with 50,000 members and supporters nationwide, and some of them are here from all over the country. And we've been very concerned about some of the proposals we've been hearing coming out of this session of Congress to cut or privatize Medicare, Medicaid, and Social Security. So we pledged to our members that we would be here today to speak to Speaker Boehner to deliver some of these messages from people around the country who are going to be hurt by cuts to these important programs. So we'd like to read a few of them, and we also have an important symbolic display of...
We're actually, unless you have permission from our press office,
Oh.
we're not allowed to.
Okay, I'm sorry. Okay.
Not only pay the bills and get medical insurance and then not have any time to see their children. I could go on and on. Please propose improvements to spend your valuable time in futile political displays of futile collaboration.
Hi.
Hi.
Wow.
Hi.
Yeah, we do have testimonials display of tissues, because these are stories that have certainly made us cry. We know that Speaker Boehner has a tendency to...
Stay firm, sir. We're in here.
Well, I can definitely pass any information that I have.
We hope that you more than pass it. We hope that you really read these. This is
We
serious
definitely
stuff.
do.
People are
We
dying.
read everything that we receive. So.
Okay.
I cried that I have medical insurance and I may as well not have it. There's a $2,500 deductible for each person in my family before insurance pays for anything, and then they only pay 80%.
With no income for the past 2 years, I had to give health insurance. I had to give up health insurance entirely, and I'm now following the Republican health plan, as outlined by former Congressman Allen Grayson. Don't get sick and die quickly.
My mother is a paramedic, and she noted by the end of her career that people, even sitting in pools of their own blood, were left waiting in the U.S. emergency rooms for 8 to 10 hours or more as not being uncommon. That is not access, and that is not health care.
After 30 years as a public servant, I only have 1 year of paid insurance upon retiring. I need to have some sort of option to carry me through until I reach Medicare age. Then I need Medicare to be there for me, intact and viable. How about a little compassion for those whose public servants that don't have health insurance for life like you have? So I tried to deliver the rest of the testimonials, but the door is locked.
Can you slide them under the door? I guess it's...
No, I already did. I just slid the remaining testimonials under the door.
Oh, good.
They locked us out.